Good morning. Welcome to the Center's 12th International Clinical Ethics Conference on the theme this year of revisiting best interests. My name is Sumytra Menon, and I'm the Deputy Director of the Center for Biomedical Ethics and also one of the co-directors of the Center's program. So welcome to all of you here today. Before we start, I was going to hopefully not bore you too much with just a few slides. So this year's theme, as you know, is on revisiting best interests. So I had a little bit of a scour through our press over the last year to see what I could find that might have some sort of correlation with best interests. So for most of you here are Singaporeans or Singapore-based. A little bit more about the demographics later, but 86% of you are. So in our news this year, we've had quite a bit about the war on salt and the war on sugar. So we're supposed to reduce our consumption of salt and reduce our consumption of sugar because we have problems with diabetes and high blood pressure. So we're all being encouraged in our best interests to refrain from consuming too much of that. And then another one of our sub-themes for best interest this year relates to vulnerable adults. So again, in the press, we apparently this year experienced, or last year experienced, a slight rise in elder case abuses, which is a bit sad. We've also had the introduction of CPF login, which requires your face, and that's supposed to be a way of preventing vulnerable people from being scammed. And the Singapore Maintenance of Parents Act, which has been around for several decades, was updated so that if parents abused their children won't have to pay their parents' maintenance when they're older. So some interesting developments in this past year. Another sub-theme this year is on mental health. So great news, ever since COVID, I think there's been more awareness about mental health. So in the past year, we've launched a national mental health and well-being strategy. But at the same time, we've also seen more studies about the prevalence of mental health amongst young people as well as old people. So it seems to be at the two ends of the spectrum. And there have also been calls for young people to be able to seek mental health help without their parents' consent if they are 14 or younger. And that's also one of the issues we will be addressing later in the conference. On end of life, we've had stories about family members caring for other family members in their extended family when they are terminally ill. Palliative care got a boost this year with better support at home. And people are encouraged to tell their stories about what they would like in their life and how they would like to see the course of it go and where they would like to pass away. And finally, there have also been some issues, again, in relation to minors and to some extent end of life, at least with the story on the left. Not quite a Charlie Gard kind of case, but along similar lines where should we be withdrawing care from a critically ill baby? In this case, this particular baby apparently had 0 chance of survival. And then we've also had some quite high-profile cases this year about teenagers engaging in sex and then things really not going so well in relation to the consequences that came about afterwards. So, next, not quite a smooth transition as I would like, but you might be wondering who is here this year. So you are among friends, but I thought you might want to know this year there are 300 people who registered for this conference, and 87% are from Singapore. We've got quite a diverse group from overseas, so welcome to all of you who've actually traveled here in person to come to the conference from as far afield as Saudi Arabia, Nepal, Hong Kong, New Zealand, Australia, and those of you from our nearer neighbors, of course, Malaysia, Philippines, Indonesia, and so on. Anybody want to have a guess why I have this sort of strange picture in the slide deck? Recognize them? Aren't they gorgeous? So this is Prince Abdul Mateen and his bride-to-be Anissa. Isn't it interesting how all princesses seem to only go by one name? Diana, Catherine, and so on. So this is Anissa. So apparently our Bruneian friends couldn't be here with us today because there's a 1-week royal wedding happening in Brunei, which is this week. So we'll miss them. Hopefully they'll be back next year. In terms of clinical ethics committee participation, 29%, so nearly, well, almost 1 in 3 of you actually sit on a clinical ethics committee or have some sort of role on the clinical ethics committee. 43% are doctors, 14% nurses, 14% health administrators, 11% academics, and 10% social workers. So that's the 5 biggest groups that we have represented. So very much healthcare professionals, are the main audience of this conference. In terms of organization, well, there you go. TTSH and IMH are up there, but so are all of the other public health institutions, and the rest come from a diverse group of mainly healthcare organizations. I thought you might want to look at a comparison for previous years, because actually our conferences usually attract about 180 people, and this year we have 300. So we were quite interested to see what was same and what was different. 57 out of you have been here before, or at least you were here last year. And if we compare it with 2019, which was pre-COVID, 23 out of the 300 of you have been here before. So welcome back for those of you who are here again. And for those of you who are attending a Centers Conference for the first time, welcome, and we hope that you enjoy the next 2 days. It's interesting, again, what the repeat registrations show. It is predominantly doctors and then other healthcare professionals. And CEC involvement has gone up quite significantly, actually, if we just compare this year's conference with last year's conference. There's a big jump in CEC, Clinical Ethics Committee, involvement. By country, this year, there are twice as many of you from overseas, so that's great news. And by occupation, again, big jumps for almost across the board. Doctors, nurses, administrators, and academics especially.